Okay, so far. Sound check for Dr. Vink and Dr. Moran. Can you,
This is Dr. Vink. I can hear you. Can you hear me?
I can hear you good, thank you.
Thank you.
Dr. Moran, can you try to do a sound check, please? If you're available. Sound check, Mr. Cartana, can you hear us?
Yes, I can.
All right, good, I can hear you good too, thank you. Dr. Diaz, sound check if you're available.
I'm here. Thank you.
Thank you, everything sounds good.
Do not have. How do I turn this off? It's on. Yep. Good evening, everybody. The time is 6:17, and I'd like to welcome everybody to our board meeting for July 21st, 2022. Welcome to everybody, both in person and watching via YouTube, and our few board members that are participating electronically. We'll start with our tribute. In partnership with the tribes who called Phoenix their home first, we acknowledge and respect the land our schools are built on. We commit to being a strong partner with any and all tribal nations who entrust their children to our schools. We are grateful and honored to be partners. I'm not too sure who will be doing our roll call this evening, but let's get a roll call going for attendance.
Can you hear me?
Yes, ma'am. Hi,
Okay.
ma'am.
Carmen Trujillo,
Here.
Jessica Bueno,
Here.
Reggie Carrillo,
Here.
Alicia Vink,
Here.
Laura Diaz.
Present.
Thank you. With that, all 5 members are here and we have a quorum to proceed. Good evening, Miss Miriam. I noticed you weren't here this evening. Are you sure you're okay to participate electronically?
I hope so.
Well, definitely let us know. We want you resting and being healthy. So please don't feel obligated if you're not feeling well. We can definitely make up for your taking time for yourself. So please just let us know.
Will do.
Thank you. With that, let's move on to our Pledge of Allegiance with Miss Linda Jeffries, please.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. With that, we can move on to our adoption of the agenda. And I hear from our team that we have a recommendation to reorder tonight's agenda.
Yes, Madam President, that was me, Dr. Vink. I would like to move item G2, request approval of the mitigation plan, to item G3, and G3, receive and discuss COVID data dashboard, to G2. So it just transfers them.
Perfect. Okay. So with that, we will be reordering to take item G3 ahead of item G2. We are not changing anything else on the agenda. So with that, do we have a motion to approve our agenda as reordered?
Jessica Bueno, so moved.
Reggie Carrillo, I second.
Thank you both. Ms. Mayor, may we please have a roll call? Or maybe,
Sorry. Carmen Trujillo,
aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Aye.
Thank you. With all five in favor, the motion passes and we can move on with our agenda this evening. So that takes us to item A4, our awards, recognition, and announcements. It looks like I'm scheduled to go first, if there's nothing prior. So I'll start with number one. The 2022 to 2023 school year is off to a great start. Last week, we welcomed 30 master teachers, mentor teachers, and learning acceleration specialists who participated in a professional development together. The theme was making connections, and the training focused on responsive practices, building relationships, student-centered coaching and coaching conversations, as well as the new teacher growth performance system and the performance growth process. The Phoenix One educator team is off to a great start.
On Wednesday, July 20th, we will welcome 65 new teachers to the district at our new teacher professional development the week July 20th through the 26th. Training topics include how to access curriculum documents and programs, setting up routines and procedures, iReady math, ELA diagnostic training, and the evaluation instrument. Teachers will also participate in a district scavenger hunt and a bus tour of the district. Then on July 27th, we will welcome all returning teachers to our campus.
Our school principals and teachers are excited to welcome students back to school. All schools have planned Meet the Teacher events on August 1st and August 2nd. For your schools, Meet the Teacher date and time for August 1st and August 2nd. Visit the district website at www.phxschools.org. Don't forget, school starts Wednesday, August 3rd. If you are new to the district and needing to enroll your preschooler, kindergarten student, or new student to the district, visit your neighborhood Phoenix One school or call 602-523-5757. Again, that is 602-523-5757. We are excited to welcome our students back to school.
On Tuesday, August 2nd, we will officially welcome all staff at our back to school celebration from 8 to 11 a.m. at Celebrity Theater. Dr. Hagikat will address our staff and share her message of hope and making connections. We are looking forward to a great 2022-2023 school year.
Wonderful. Thank you all very much for taking the time to read those. We'll move on to item B1 with Dr. Davila Hagigat. Good evening.
Good evening, President Trujillo, Vice President Bueno, members of the board, and Ms. Osagi Johnson in our cabinet. I come with, again, great information as it pertains to our welcoming. We were able to welcome our lead custodians, and our cabinet team had the pleasure to introduce ourselves to our lead custodians at their welcome back meeting. And I do want to extend a thank you for all that they are doing as they prepare to receive our students, our staff, and our families. Moving along with welcomings, I want to also share that I was able to be a part of the new teacher welcoming here at our boardroom. This room was filled with tables and great faces and energy. And we were able to see teachers that are brand new to our profession and teachers that are choosing Phoenix #1 as their new home. And we're going to have that journey together. I also want to extend gratitude to Dr. Gonzalez and her team for planning, preparing, and delivering just a phenomenal few days for our new hires. And so thank you also to our HR department, as they have been able to really crank it up and get our teachers here in a timely manner. Also, I have been spending time getting to know our principals through our personal interviews. And again, I'm grateful to be leading a team that is passionate. It's a team that really puts kids first. And I just look forward to an amazing 22-23 school year. Each one of our principals that I've interviewed is very proud of their community and what makes it special. And I look forward to visiting our school sooner than later. I did get hit with a head cold, and I wanted to make sure that I followed all of our mitigation plan so that I lead by example. So very soon I will be out there really enjoying the communities in person. So thank you.
Thank you very much. Great content. I saw some great pictures online in our social media, so I am just as excited for the new teachers, returning teachers, and educators all around us. So great work, team. With that, let's move on to our item C1, board reports. Any board members have some news they'd like to share?
Yes, I just wanted to also extend my gratitude to Dr. Gonzalez and her team. I was able to attend yesterday's new teacher orientation activity luncheon, and it was just amazing just to hear from our leadership, Dr. Hagigat and Dr. Gonzalez, just how innovative we're thinking and how we want risk takers, and we really want to lead this district in a good direction. So I thank you and appreciate both of your time and all the commitments that your team has done. So thank you so much for that. And I wanted to also say thank you. Oh, on top of Dr. Gonzalez's team, I know HR and IT had a lot to do with the new teacher orientation. So thank you to all those departments. And I'm sure there's many more that are missing, but that's what I saw and experienced yesterday. The message that I sent from the board is that we're very focused on equity, and that's always going to be front and center for us is our equity plan and upholding that. So that's what I expressed from the board and just welcomed the new teachers, that we're excited for this new school year and that we're here to be helpful. And lastly, I just want to say thank you to Dr. Hagigat for the back to school rally that we plan to have on the 2nd. And I plan to be there. I don't know if any other board members plan to be there, so that way we can post a notice of a meeting or quorum, whatever we need to do, but I am planning to be there. So thank you.
Thank you. I want to definitely echo Ms. Bueno's comments. I wasn't able to participate yesterday, but thankfully she was. And she really was super excited about everything going on. So kudos to Dr. Gonzalez and the team. I also wanted to share that I am excited about the beginning of our new school year. It's right around the corner. I just wanted to thank our entire district administration for staying in constant communication with each other, our district attorney for staying in contact with us. So we're all, the board members individually can ask questions, and we're as prepared as we can be for August 3rd. So I say that because we are still surviving this pandemic and the impacts it has on our community, and it worries me, but I feel like we're much better prepared this year than last year, and we did our best then. So I'm excited to see what we come up with this year. So other than that, I'm also really excited about August 2nd. That seems really exciting. And so I look forward to it because I plan to be there as well. Thank you. Any other board reports? All right. With that, do we have any community communications this evening?
There are none.
Okay, great. We'll move right on past that. Let's see. Does that take us right to our consent agenda already? That went really quick. All right. Do we have a motion to approve our consent agenda as presented?
Jessica Bueno, so moved.
Reggie Carrillo, I second.
Thank you. Hearing no discussion, may we please have a vote to approve our consent agenda this evening?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
With that, our motion passes.
Sorry, I couldn't figure out how to unmute.
Oh, it happens. With all five in favor, our motion does pass and our consent agenda is approved. And with that, we'll move on to item F1 regarding our MOU. And who will be presenting on that? Dr. Gonzalez.
I'll provide a
Wonderful.
quick update
Thank you.
on
Thank
that.
you.
Is that microphone working? So this is a partnership with Makisa, a longtime partnership with our district, helping to provide supports for our teachers. This is a unique new opportunity that the county schools received for through the American Rescue Recovery Act. So these are ARP funds. The purpose of this grant is to provide learning acceleration specialists who will be working in 9 of our schools, providing supports to our teachers so that they are able to work with students and capture strategies that are going to help them model best practices to help recover learning loss for students. So the grant, we will not receive funds, but what we will receive are services from the Maricopa County Education Services Department. And that the funds are represented with the 9 learning acceleration specialists working in our schools. And those are schools where we specifically do not have a master teacher, with one exception. The purpose of this, again, is to try to create coherent systems so that all of our teachers, regardless of which school they're in, that they have somebody who's helping to promote best practices, helping to provide planning support so that they're planning. And again, coming back to those theories of action that we have about when teachers plan together and have good information to group students appropriately, and when students are able to work at an individualized place in their curriculum, that they're going to accelerate learning more rapidly.
Thank you very much, Dr. Gonzalez. Any questions from the board? Questions or comments? Interesting. Okay, hearing none.
Real quick, just, would this be our first partnership with Maricopa County Superintendent?
Our partnership with Makisa, the former partnership that we had was the REAL grant, which is where we had a series of different people working with us, and that was what gave us the opportunity to give stipends to teachers.
Mhm.
This is a different kind of grant, so this is more direct side-by-side classroom support for teachers as opposed to money that comes to the district. And the specialists are paid by the Makisa, by the Maricopa County schools.
Okay. Thank you.
I have just one question. So the specialists are hired by them as well, and so how are we providing feedback? Like, what if that specialist isn't working out on a campus?
That's a wonderful question, Dr. Vink. So the county schools hired the specialists, but we then get to interview these specialists and assign them to our sites. You've met Leslie Beecham prior. She is the person who's going to be working with us in helping to supervise them, and they'll be co-supervised by the principal and with the Makisa, so that we're able to make sure that they're meeting our needs. They're holding themselves to the same standards that we're holding our master teachers to, and we're agreeing on what are the assessments that we're going to use to look at performance, what are the expectations that we have. And in fact, we had a planning meeting recently where we all sat down to plan together to make sure that our master teacher curriculum is coherent with the learning acceleration specialist, so that it's a real tight connection between the two.
Great, thank you. And this may be in the document, I'm sorry. Are they certified teachers as well?
They are certified teachers. They are master teachers who have an exemplary past performance record.
Fantastic. Thank you so much.
Dr. Gonzalez, how many schools do we not have master teachers at? Approximately, maybe, or? Got it. Yes, thank you very much. And ultimately, like, is our goal to have them at all schools when this partnership is no longer either in place or available? Okay, just wanted to make sure. Yeah. Yes.
I'm actually having trouble hearing the responses.
Oh. I know, it's like we can hit the replay.
Is that
button.
better, Dr. Diaz?
Yes, I can hear now.
Okay, I'll try not to move my head while I'm talking into the microphone. So this was a pilot for our master teachers, and the purpose of being really tight in terms of what we are measuring is to ensure that we know whether or not this pilot is a good investment of resources and that it meets the outcomes that we intended when we presented our plan.
Yes, I do remember being excited about that meeting. Dr. Diaz, was there anything you can think of that you missed that you were maybe waiting expectantly to hear? The number of schools that we don't have master teachers at is 7. I'm not sure what else you might have missed. So
No, that was what I had missed. Thank you for clarifying.
good. Thank you for speaking up. Definitely want to make sure everybody can hear and be heard. So thank you. Any other questions? Hearing none, do we have a motion to approve our MOU between Phoenix #1 and the Maricopa County Superintendent of Schools?
Jessica Bueno, I motion.
Roger Carrillo, I second.
Thank you very much. May we please have a roll call vote?
Yes. Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Aye.
Wonderful. With all five in favor, the motion passes. And we are excited to see where that partnership goes. Thanks. With that, we can move on to item G1. New job description. We're excited about this one. Will the floor move to Mr. Quintana? or-
President Trujillo, we have a request because we have a guest
Okay.
for the item regarding the mitigation plan.
Okay,
And our guest needs to leave at 7:15. And so we're wondering how we can go about bringing two items forth before this one. One of them was our update for our COVID, and then the second one would be the mitigation plan. I know that we approved through consent agenda the moving of the update, but we don't want to miss out on our guest this
Yeah,
evening as well.
absolutely.
So
with-
we'll take your guidance.
with that, I believe we should reorder to have Mr. Quintana's part quickly first, and then we can hear, we can go for hearing item G2, and then after that, we'll come back to the job description without objection, of course, if everyone's okay with that. Sweet. Yes, Mr. Quintana, would you please present on our district update regarding COVID?
Yes, thank you, Madam President. We have Mr. Linda Jeffries and Dr. Victor Diaz that are taking the lead on this this presentation this evening.
Wonderful, thank you. Good evening. Perfect.
Thank you. Good evening, President Trujillo, members of the governing board. Tonight, it brings me great pleasure to present the COVID-19 data dashboard update. And so last week, you'll recall that we shared information on how the CDC now measures the COVID-19 by the community levels of low, medium, and high. And in looking at Phoenix Elementary's district, according to the Maricopa County Department of Public Health Services website, our district community level is currently at high. This is as of yesterday, July 20th. And then in looking at our community level by zip code, in which the 7 zip codes in which our schools reside, you can see that 2 of our 7 zip codes are in the medium community level, and then the remainder are in the high level. And so with that, that concludes this portion of the community level and data dashboard.
Wonderful. Thank you very much for jumping in.
Yes, you're welcome.
Get that to us a little quicker. I appreciate it, Mr. Jeffries. With that, we'll move on to the request for approval of our Phoenix 1 mitigation plan recommendations.
Thank you. Again, good evening, President Trujillo, Vice President Bueno, members of the board, and Mrs. Arostegui Johnson. Today, I have the opportunity to open up for a very important topic. Our Phoenix 1 mitigation plan. Phoenix #1 has partnered with Healthy Verified to continue utilizing their legal and medical expertise to help us navigate through the impact of the worldwide pandemic. We want to keep in mind that while Eric Hill is not our district's lawyer, he's a lawyer that supports Healthy Verify. I also want to share with you that we are very excited to welcome our students and their family on August 3rd, and we are already welcoming staff new to our district, and we will be welcoming returning staff next week. Part of our welcoming is to provide this communication regarding our Phoenix 1 mitigation plan. So before we get into the details of the plan, I want to share with you our process and timeline to reach the recommendation that we will be presenting to you this evening. If you get an opportunity to look at the display, you will see that we've been partnering with Healthy Verify. The week of July 11th, my cabinet and I really prioritized the mitigation plan and really moved things into action. We wanted to make sure that we had the right components that allow us to address the needs of our community. On July the 14th, our Phoenix #1 governing board received information that was provided as part of the mitigation plan, and we were able to get feedback. On July 18th, Health to Verify was able to share a draft, and we went ahead and discussed it in a meeting with our district safety committee with principal representation as well. And then cabinet has been putting numerous hours in making sure that we comb through every single line. We have been able to get board member feedback and respond to that. It's really been a collaborative effort that allows us to get to where our recommendation is today. And so today we are recommending that we are able to approve what Healthy Verify has provided for us. It's important that we consider the factors that are outlined here that also include our ability to get that plan really approved by that review team. We are not anticipating any content changes. And today we are very pleased to have both Eric Hill and Dr. Moran here with us for questions so that it allows us to approve this with a high level of confidence so that we can communicate that. So I want to turn it over to Mrs. Jeffries and Dr. Diaz as they will share the components of the plan.
Thank you very much, Dr. Hagigat. President Trujillo, members of the board, members of the cabinet, and I think most importantly, members of the community. Because at the end of the day, what we're here to do is to keep us all as safe as possible while still moving learning forward and all the things that we do in our schools. And so, as it has for now the past several years, brings me a lot of humility and honor to present the hard work of this team in terms of the mitigation plan components that I'll be presenting on today, this evening. These components are derived from what the CDC has found and what the CDC recommends. Healthy Verify takes those and advises us as a client to then enact a plan that encapsulates what the CDC says. Of course, it's not that simple because we know that CDC guidance can sometimes be contradictory to local health authorities, and there are a couple of cases where you will see that. But we also know that there's a legal context in terms of what the state allows us to do, or more specifically, does not allow us to do. So in navigating all that and balancing all that, we do have the different mitigation plan components I'll be presenting on today. These components pertain to when somebody is sick, they're experiencing symptoms of COVID-19, or when somebody has tested positive for COVID-19, or when somebody has been exposed to COVID-19. And so it really starts at the very top here, which is that if you are sick, we encourage you to stay home. This is not any kind of district where we want to encourage a wounded warrior to come into our classrooms. We want people to rest, and President Trujillo, I really appreciate the way that you modeled that at the very beginning of this meeting. If you're sick, stay home, rest up, but also get tested for COVID-19. If you do test negative, we tell folks to stay home until their symptoms have improved and they've had no fever in the last 24 hours. But if they do test positive, we've provided this chart in order to help them navigate the process of what we do. Or if they know they've been exposed to COVID-19, we navigate this process. And so I'll start with folks who test positive for COVID-19. If a person finds that they have tested positive, the first thing that we ask is whether or not they have symptoms. That is because the counting of their isolation time depends on the day the symptoms started or the day of their positive test. Either way, they are told to isolate for 5 calendar days. We've highlighted that because that is one change from the previous year's plan where we were doing 10 calendar days. And again, that comes from CDC guidance and Healthy Verify's advisement. After those 5 calendar days, they can return as long as their symptoms have improved. They've had no fever for 24 hours. And again, a change from last year, it is strongly recommended for folks to wear a mask around others for the 5 more days from symptoms or from the beginning of their positive test. We wanted to highlight that to show that we're doing everything that we can within law in order to strongly recommend masks, knowing that we cannot mandate them. The other half of this are for folks who've been exposed to COVID-19. They've been exposed to somebody who tested positive. The first question we ask ourselves is whether or not they had COVID-19 in the past 90 days, again, based on CDC guidance. If they have had COVID, we then look at their symptoms. If they have symptoms, again, if you're sick, stay home until you're feeling better and get yourself tested. If you're positive, well, we just went over that protocol. If you're negative, again, only return after your symptoms have improved. But if a person has had COVID-19 last 90 days and they have no symptoms, they do not need to quarantine. Of course, if they start to get those symptoms, we then send them home. If a person has not had COVID-19 the last 90 days, we then look at people's vaccination status and whether or not their vaccines are up to date or if they never got a vaccination at all. If you are exposed to COVID and you have not had COVID in the last 90 days and your vaccines are up to date, again, you don't need to quarantine. But if you were exposed to COVID, you have not had COVID 90 days and your vaccines are not up to date or you're never vaccinated, we will require a quarantine period of 5 days. And highly recommend that a person takes a test after 5 calendar days as well. Again, if it's positive, we put a quarter in the other carousel. If it's negative, they can only return if their symptoms have subsided. Again, strongly recommending that a person wears a mask for those 5 additional days. So zooming out, we've created this flow chart because I know that could be quite a bit to navigate, that we will make sure is posted at our schools, that our health and safety managers and principals at schools will have. They'll be in our health offices. We'll have them handy in every corner that we need to as we navigate these guidelines. As we do that, the other tools that I wanted to point out, again, with this being based on CDC, the CDC does have 2 different calculators that we've already asked folks in our benefits office to bookmark, and we will now ask our front office staff, our health office staff as well. I just wanted to take a moment to share those with you. They are very handy, starting with a calculator that's used to determine when a person has to quarantine or a person needs to isolate. And the way that this tool works is you select the option that best describes you. You tested positive for COVID, or you had close contact with somebody who did. In this case, I'm going to choose that I've tested positive for COVID. Again, we'll ask you about your symptoms. I'll say that I'm asymptomatic. For the sake of counting days, I'll put in July 20th. And so now what this will tell me is that I can leave my home on July 26th. Now somebody might say, wait a second, that's 6 days. Well, that's because your first day is considered day 0. And so we start counting the day after that. And again, I need to wear that mask until July 30th. Again, you can use this for any of the options you see on there. If I had close contact with somebody, it asked me if I had it in the last 90 days. I myself personally have not had COVID in the last 90 days, so I'll select that. It will then ask me if I'm up to date with my COVID-19 vaccines. I am up to date, and I'll show you how I know that in just a moment. And again, for the purpose of counting, I'll say I had close contact with somebody on July 20th. I do not need to stay home unless I get symptoms. And so this will be a tool that we're going to make sure that we use very, very frequently as we navigate these. The other tool is this very handy tool from CDC about when I can get a booster, or when anybody can get a booster. Again, you can click here, answer some questions. Between 18 and 49 years old. I do not have a weakened immune system. Thanks to all of our partners at Phoenix Union, I took advantage of getting Pfizer vaccines at the very onset of vaccine rollouts in the community. Thanks to Linda Jeffries, I got a booster at the Dia de los Muertos festival that was at the Basilica. I did not know that they were going to have boosters there until an email that she sent to all district. They gave me a Moderna booster because they ran out of Pfizer. And this considers me to be up to date. The factors that would change is if I was over 50 or if I had a weakened or compromised immune system. So again, these are just very, very handy tools that we're going to make sure that we use at all times. It's really one of the benefits of aligning this plan to CDC's guidelines as closely as we have. And so at this time, I'll turn it over to Ms. Jeffries to continue in our presentation.
Thank you.
And give me just one moment and I will fast. Oh, are you doing it at the same time I am? That's okay. Here we go. So we wanted to provide a little additional information to you from the CDC website on what close contact and quarantine looks like. This is guidance specifically for K-12 schools. So you can see on the left-hand side, it talks about the guidance for students in indoor classroom settings and also structured outdoor settings. So it gives their guidance. And then on the right side, it's students in non-classroom settings and adults all in school settings. So this is a great resource that we will also make available to our families and at our schools. So if anyone is interested in really better understanding what close contact means in the school setting, we've got this as a great resource. And then moving forward, as we talked earlier, last week, we talked about how the CDC measures the levels of community or of COVID-19 through the community levels of low, medium, and high. And Phoenix #1 will use this recommendation where COVID-19 is impacting our sites. Oh, let me just. And then due to the district aligning our new recommended Healthy Verify mitigation plan and using the CDC guidelines, we've made a few minor corrections to the plan. And I'm going to go ahead and share that plan with you and talk you through the minor adjustments. And so if you look at page 2, after the table of contents, we are deleting just a few minor things. We're deleting footnote number 3, and also in the second bullet, I have it highlighted on your copies. The wording is, or if a person does not test. So these deletions are in direct response to what we're finding specifically on the CDC website. And then if you look on page 7, we are making those same corrections under the student guidelines. So those are the only minor changes that we are making to the plan. And with that, we have Mr. Eric Hill and Dr. Moran who are with us. And so they will certainly be available to answer any questions that you might have.
I just want to ask a quick question. If Dr. Vink and Dr. Diaz have this copy also, because I know we have it here in person, but I don't know if they've received it digitally.
They received the initial copy, but we will definitely be sure and email this to them. If they have their copy in front of them, they can easily see, and I'll be glad to repeat that. But those changes, the deletions were on page 2 after the table of contents. And what we are deleting is the footnote number 3 and wording that says, or if a person does not test.
Thank you for clarifying that.
And then those same changes are deleted on page 7.
I have a quick question. Is there any rationale that the CDC provides on their guidance regarding just like the method of when to wear a mask and when not to wear a mask, like 5 days or based on whether or not you have vaccines? Because it seems like there's lots of different pathways. I'm just curious.
Thank you. We appreciate the question. And I believe that Dr. Moran is here to support us with that. Dr. Moran, welcome to Phoenix #1 this evening. Are you able to hear the question? And are you in a place where you can respond?
Yes, good evening. Thank you for having me tonight. So a couple of observations about the CDC or ADHS or Maricopa County guidance, wherever you guys got that fluxogram from. It is based on a few factors. Number 1 is distance. Number 2 is vaccination status. Number 3, the other factor they take into consideration is history of recent infection. And to a certain extent, it has not been updated with the data that has been available in the last 6 months. Starting with the factor number 1 in terms of vaccination status, I'm sure you all guys are aware that while the vaccines continue to be extremely effective in preventing hospitalization and death, the new variants, particularly Omicron and the BA4, BA5, and the other sub-variants of Omicron are very immune evasive for what pertains to mild infections. In other words, the vaccine effectiveness in the community against symptomatic infection, a mild infection, it wanes down to 22% by week 10. And that is including the 3rd dose. In other words, your protection against mild infection is only good for the first probably 4 to 6 weeks after you get your 3rd dose and probably your 4th dose. That's data that's on the works. But essentially, discriminating in terms of quarantining, discriminating or rather determining the chances of getting infected by vaccination status is actually out of date. Because now we know, and this is data that we knew since late December, early January this year, and it's been published already in peer-reviewed scientific journals and studies from Canada, Israel, UK, that after 10 weeks, the effectiveness of the vaccine in preventing infection is very low. So if you are going to quarantine those who are not vaccinated, but those who are vaccinated, you're going to let them come back. Chances are you're going to see what we're seeing in the community. The majority of people getting mild infections are vaccinated, boosted people. Okay, so that's factor number 1. Factor number 2 is the factor of recent infection, and it says 90 days. However, when you look at one of the websites or one of the screens of CDC itself says, we acknowledge protection from prior infection for up to 6 months, yet their quarantining recommendations make the cutoff at 90 days. Furthermore, in the last 3 months, more studies, including in the New England Journal of Medicine and the British Medical Journal, studies from Israel, Canada, and Qatar, and even a study from here from the United States that was published in MMWR show that the protection from prior infection, even in the absence of vaccination, in terms of preventing severe disease, reinfection, and death, actually is just as good as having 2 or 3 doses, or pretty much just as good. Definitely people who have 0 vaccines are at the greatest disadvantage, and we should continue to encourage those who've never been infected and never been vaccinated to get the vaccine. So when you discriminate someone who's been infected and you make the cutoff at 90 days, you're actually missing out on what CDC itself says in their website in one of the screens. They say it's 6 months, but the studies from Qatar show at least 12 months, if not longer. So I think that guidance from CDC is outdated from the studies that have been published, even by themselves in MMWR. And I think thirdly was the quarantines in general. Since the summer of, actually since the spring of 2021, there have been studies and epidemiological reports showing the lack of usefulness or effectiveness, I should say, of quarantines in school-age children. I'm happy to share a list of the studies and epidemiological observations. And I can tell there are a number of schools that since the fall of 2021 here in Phoenix have actually eliminated quarantines after exposure in the school successfully. In other words, no outbreaks. What I can tell you is a study published in the UK where they actually looked at students from primary through secondary education up to age of 17, where they actually randomized the students to either stay in school after a school-related exposure to COVID. So they separated them randomly, either stay in school or go home for 10 days. And there was no difference in the number of secondary cases in both groups. Not only that, but multiple states in the United States have actually done away with quarantines, some of them doing what is called test to stay. And some of them don't do the test to stay, they simply do not quarantine, but they encourage parents to observe for symptoms after a school-related exposure. In the last month, the Nordic countries have actually completely eliminated testing and quarantining of students of school age. You know, there's data from from the United States, data published in peer review journals that actually suggest that such strict protocols might not be cost beneficial, because I'm thinking, you know, of your teachers being absent out of, you know, because of quarantining, if they only have 2 doses, when the recommendation is now for 3 shots for pretty much everyone 11 or older. And then you're going to quarantine that teacher, and then you may end up having a lot of absenteeism among your staff and faculty, and then a lot of school days missed for children. When there is data, at least since, you know, the last 12 months, that shows that at least for children, quarantines after school-related exposure are not that cost beneficial. So those would be my comments. Other than that, I mean, I commend you guys for, you know, as a doctor, I'm very proud of, you know, being connected with you or related to you through Healthy Verified, because your priorities are in the right place, right? Keeping everyone safe.
Thank you. This was extremely helpful. I would love to see those articles. I was just curious because I never really understood why those specific guidelines were in place. They seemed a bit arbitrary, but I'm glad to hear that there are articles that provide more information.
Absolutely. I will share through Mr. Hill. I actually made a summary in May this year. But I will update it with new studies because this data that I've mentioned has actually been around for, so the quarantines since last summer and the vaccine effectiveness against infection since late December, early January. And infection, the protection from prior infection at different times through the pandemic, but most strongly over the last 3 months.
Wonderful. Thank you so much.
Dr. Moran, I wanted to thank you. This is Dr. Ving for making time for us tonight. I'm so glad that we're getting to hear from you. It's really important to me to have research and data to support what we're doing. And listening to you speak, I guess I'm a little confused. Does the research, the current research and data, not support the mitigation plan that we're proposing?
Well, your school district has decided to follow CDC guidance. If you ask me what is the latest and what the studies show, what I just presented in the last 10 minutes or so, that's the answer to that. Again, there's some leeway in terms of how you apply the recommendations from the CDC. Again, that's recommendations, right? Those are not mandates. And there is some data from experience from schools that I have been involved with that I can share in terms of how those modifications to the CDC recommendations actually have panned out in terms of number of cases. I'm happy to share that data too, if you would like to see it.
I do think that more conversations with you and more information is really important. I absolutely, believe in the Center for Disease Control and their recommendations, but I also understand that we are in the midst of some variants that are changing things quite rapidly. And that was actually one of my questions for you, is just looking at the current variants, what should we expect to see with 5,000 students in classrooms in Arizona in the next couple of months?
So in terms of, what kind of effect are we going to see from the variants, right? The characteristics. So I prepared a talk in late December, early January regarding Omicron, when Omicron was starting to make its way. The first versions of Omicron started to make their way through the world. You can see that the case fatality rate and the virulence or the capacity of causing severe disease on Omicron has been much lower compared to Delta, Alpha, and the Wuhan strain. BA.5, which is now over 50% of the circulating strains in most parts of the United States, actually has the similar pattern. It is extremely transmissible, so highly contagious, but has much lower virulence. So the way I see where we're heading in terms of what's going to happen to schools is actually is what's going to happen with the pandemic, essentially, right? So we're going to see the virus will continue to mutate. There is no way around it. We will see a new variant every so often. Like you mentioned, and it changes quickly, it's true, and it changes in becoming more, like I said, more transmissible, less virulent, so less capable of causing severe disease. And the other thing you're going to see based on CDC data itself is that at least 60 to 75% of children across many states in the United States have actually already been infected. And we know from the studies that I mentioned earlier that prior infection protects against hospitalization and death. Children intrinsically are multiple times less likely to have severe disease compared to adults, but most of your adults are vaccinated, meaning faculty and staff, right? I don't know what happens to the families, but most of your faculty and staff are vaccinated. Many of them are boosted. Many of them have received probably a 4th dose. And so what we're going to see is a lot of mildly symptomatic infections, very minimal percentage of hospitalizations, and you can see it on the Maricopa County curve of hospitalizations. We're not nearly at what it was in December or July last year in terms of number of beds occupied by COVID patients. Okay, so then much less land. Then we also have, so what's going to happen to children? Now we have vaccination available for children 6 months or older, and should parents decide to do it, that's certainly an option that they will have. Then we also have therapeutics, Paxlovid, monoclonal antibodies that are widely available for adults, especially those at high risk. So what we're going to see is a transition to endemicity, which I think we have already started, because you can see that despite the number of cases spiking, the hospitals and the ICUs are not getting packed with patients. And the reason why you're seeing more cases is because everyone is getting tested, as opposed to flu, for example, right? I can tell you that in the last season, and I do see patients in the hospital, in the months that after the Omicron wave, we saw many more flu patients, adults, I don't see children, adults, many more flu patients than COVID patients coming into the hospital. So I hope this answers your question as to what are we going to see in the schools working at full capacity, both for kids and adults. I think that's what we're going to see. We're going to see, cases going up and down because we test quite a bit for everything, for COVID, I should say. We don't test for other infections, which, by the way, studies in the UK showed that the last winter, many more kids were hospitalized with RSV than with COVID. But anyways, so we're gonna see cases going up and down, but we're not gonna see mortality or hospitalization going being high. And we're gonna see much more widespread use of therapeutics and the clear transition to endemicity. I do not know when CDC will update their guidance, because the guidance that you just read has been there for the last 6 months, right? And in fact, I think in March 25th, they updated it to make masks optional. Even CDC made the masks optional, though linked to the level of transmission in the community, well, level of hospitalization in the community, not necessarily transmission. So again, I do not know when the CDC will use the data that I see being published. I'm not a public health authority, and of course you're free to follow the CDC. But I'm here. The point of my existence in Healthy Verify is to bring the latest research and present it to you, so that you can make decisions or tweak the CDC. Not tweak, but adapt the CDC recommendation to your particular reality. Remember, in Maricopa County, we have a high percentage of previously infected people, which goes in correlation with lower virulence, lower mortality, lower hospitalization.
Thank you, Dr. Moran. I don't want to take much more of your time because I know that you need to hop off. But I do just want to say that I think the board, or at least I know that I was very open to the research and the data at our previous meeting in April when we made some decisions. But because we didn't have access to you that day, for whatever reason, to have these kind of conversations, we defaulted to strictly CDC. So I think that's where we're going to be at today, because this is the plan that we have presented to us. But I would entertain a plan that you have created with the data and the research cited, of course, so that we can see what that would look like, and with other schools or areas that have followed those recommendations listed as well. So thank you again. I really appreciate you making time for us.
It is my pleasure. Thank you. Good evening.
I just wanted to share also that our team will continue to update and look at the research and see what else comes in as we continue to make choices and be responsive for our community to really deal with what we're going to experience as part of this COVID worldwide pandemic. So thank you for that, Dr. Moran. We appreciate it.
My pleasure. Thank you.
Thank you all. I do have a question for Dr. Diaz, if he doesn't mind coming back up here. You did mention that we are not able to enforce masks this go around. So I was wondering if you could just touch on that small piece for our meeting as well.
Yes, President Trujillo, members of the board. Dr. Hagi, we did confirm today with Chris Thomas from Gus Rosenfeld that in the last legislative cycle, legislation was passed that does not allow us as a public entity to enforce any mask mandate of any kind. whether that's related to the general wearing of masks or having to wear masks if you've tested positive or if you've been exposed. We are not allowed to have a mask mandate. He did make very clear, though, that there's nothing in that legislation that would say we can't strongly recommend it. We can't, we can certainly do that. We can model it. We can encourage it. We just can't require it.
Perfect. Thank you very much. I just wasn't sure if there was a certain bill or law, but I do appreciate it because that is such a huge, for me, at least for my thoughts on it, just knowing that there are those parameters in place that we do have to work around, which we did before, but with this administration, just we have to be clear on those things. So I appreciate it. With that said, what does it look like when our school plans to strongly recommend? I guess, how does that decision get made? And I guess, do we have a small part of the plan of what that part looks like?
Yeah, Mr. Members of the board, strongly recommend. We really started that in April, and I think we're doing it right now. For folks that are watching home, if you can't notice, just about all of us have a mask on, and that's not unintentional. One way to encourage it is to model it. Our schools got very, very good at making the routine of making sure your mask was on, it was covering your nose. Our students are used to that, our kids are used to that. And so when it comes to strongly encouraging it, I think there's a couple different ways you'll see that. One is going to be from the adults and from the staff, again, doing it themselves and model themselves. We certainly have staff that are concerned at the level at which that they will wear N95 and they'll model that for students. When it comes to our health offices, our nurses are very good at encouraging all kinds of healthy habits, whether that's through our child nutrition, through what's going on in the playgrounds, and certainly when it's going to pertain to this as well. The different schools, they kind of put their own flavors, they put their own spins on it in terms of, this mask protects you and me, that type of signage that you'll see as well. We want to make sure that we're being very intentional, that we're creating a culture of mask wearing where masks are accepted, they're understood, they're valued. And that's something that I feel that because of the experiences we had last year, we've already got a leg up on and trying to model for next year. We also said already in our new teacher orientation, where several of the staff members who were facilitating at different times when they were in close contact with others were masking up. And I do believe that we had some participants who on their own volition brought masks as well. It was probably very relieving for them to see that this isn't the sort of place where if you wear a mask, someone's gonna look at you kind of funny. Because I've certainly walked into places that are like that. But rather, again, a place where the culture here is that we're affirming and we're accepting of people that want to take that step to protect themselves and protect others.
Thank you very much. So with that said, will we be providing those in the classroom? Will we, because I know we do that all around here. So I just was wondering, or I guess just to clarify out loud that that's exactly the same thing that's going on in classrooms and things like that. I do remember us getting a big supply of them, but I don't know how well that's going. So I'm just gonna assume, since everyone's shaking their heads, we do have enough of those going around. So that was my question. Anybody have any other comments or questions? Any recommendations?
I have another question.
Okay.
If there was, I can't see the diocese very well, so I don't want to interrupt anybody else either. Did Ms. Bueno or Mr. Carrillo have anything? No. Okay. Regarding tests, do we still have a supply of tests at our schools, and are they still within their expiration dates? And if they are set to expire soon, will we have more tests available?
Yes, Dr. Vink, members of the board. When it comes to masks, when it comes to tests, and when it comes to vaccines, availability and access are certainly going to be the two most important things. We do have masks that we will have in classrooms, we'll have at schools. We'll make sure that those are readily available. When it comes to tests, Sarah Sims and others in our district have been probably the people at the forefront. I would stand us against any school district in the state in terms of the level of hustle that we have when it comes to getting tests and PPE. Even still, when we're seeing schools not have any mitigation strategies at all. I learned of a school today that even if you test positive as a student, as long as you're asymptomatic, you can still come in person. And so we will continue to make sure that we have those tests available. We have PPE available, and then we're spreading resources when it comes to getting vaccines. We've already begun the process of working with the partners we've worked with for the past few years to make sure that we are able to hook our community up with existing clinics, as well as continue to explore having that wonderful van from a place like Wesley being in more of our schools, and making sure that folks are making boosters part of their back to school routine. Just today, I sent an email to all district staff, and in it, I shared that CDC tool about getting a booster and a couple of resources in terms of where boosters could be found.
Thank you. And then speaking of Wesley Health, do we have any, I think we had talked about expanding them to all campuses at some point or rotating them or whatever. It sounds like kids are going to get sick mildly, but they are going to get sick. So how do we ensure that that mobile clinic is accessible to as many families as possible? And how are we communicating that to families?
Dr. Members of the board, that is certainly one of the first items after the mitigation plan has been approved. This mitigation plan puts a lot on testing, on masking, and again on vaccines. I think it's very effective in making clear those are the three rings, if you will. And so we will go right into the mode that we've been in terms of working with those partners, leveraging those resources as much as possible to make them as available as possible. We know that partners like Wesley and other organizations are interested in partnering with us beyond just COVID vaccines, but making that part of their partnership. And we know our principals are thirsty for it and they're looking for it. And so as we are gearing up for the school year ahead, members of my team, members of the health and safety team that we've constructed at the district level, will work to maximize those resources and get them into our communities.
Okay, thank you. Yeah, as long as we can make sure that families do have access. I was speaking with a parent recently, and they even mentioned like having access to basic things like a thermometer to check their kid's temperature. Not all of our families have those, or the extra $20 to run to Walgreens and grab meds and thermometers. So we want to make sure that our families have as many resources as possible, and that we can communicate that effectively is really the key there. My last question is another thing that I heard from families multiple times last year was, and I don't know if this is a question for you, Dr. Diaz, but is about attendance. The families are getting notifications that their child has missed too many days. How are we communicating to families that your child's health is the priority and not attendance?
Dr. Vink, this is Deborah Gonzalez. We have just been talking about that with our MIS team that oversees our attendance tracking. The letters are generated as an automatic response to students who are missing, in part because we want to make sure that we have an opportunity to connect with families to ensure that their students are well. And so one of the actions that we're talking about today is actually having a script for front office staff that when a family gets that letter, we call and follow up with them to make sure that their children are well, and that if there's anything that we can do to facilitate helping their child come back to school safely, and that their health is our number one priority. It's also a great way for us to just do regular check-ins to make sure that our children are safe, even if it's not related to COVID, if they've missed more than a certain number of days. So the letters are generated to go out at 10 days and 15 days. so that we can follow up and track our students in that way.
Dr. Gonzalez, I love that response so much, and I greatly appreciate your team. The last thing regarding attendance, I know that some schools have traditionally celebrated attendance. Are we still communicating that maybe we don't do that right now?
Dr. Vink, that's another one of the items that we're working on. Rather than having perfect attendance days, we really are encouraging our schools to have extraordinary effort awards as opposed to perfect attendance. And at the beginning of our presentation today, you heard our team members talking about the fact that we don't want to make people come to work when they're sick. We want people to stay home and take care of themselves when they're sick. We want to encourage the same of our students.
That's fantastic. Thank you so much. I appreciate you and your team, and you as well, Dr. Diaz. Thank you.
I do just want to add and piggyback off of Dr. Vink's message about the vaccinations. And especially now we see rises of monkeypox and other viruses and diseases that exist. I think our message should just be continuously be that our vaccination just be updated, and that way we can just really encourage our families to stay safe by being responsible and having their vaccinations up to date.
I have one last question. The discussion about partnering up with the same agencies we've had supports and resources through, does that also include the pooled testing resource that we used to do, or where does that fit into the plan, or does it not?
Yeah, Ms. Trujillo, that's a wonderful question. The county, to our understanding, this time has not been clear as to whether or not they're going to offer the pool testing. We know that in April, we did stop doing that after receiving numerous amounts of feedback from families, from students, from even nurses and teachers about the complications with it, where essentially the system that was created was overwhelmed by Omicron and never really rebuilt. The county did not do webinars over the summer, but they are hosting one on Tuesday. We will make sure that district representatives, myself included, will be in that webinar so that we can learn what other resources they may have for us.
Thank you
Absolutely.
for letting us know. Trying to get back to my agenda for the item. Hearing no further discussion, I feel like we might be ready to vote on this item. Yes. With that said, do we have a motion to approve the 2022-2023 Phoenix 1 mitigation plan recommendations?
Jessica Bueno, so moved.
Thank you.
Reggie Carrillo, I second.
Thank you very much. Ms. Miriam, if you're able to, may we please still have a roll call vote, please?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Hi.
and Laura Diaz.
Aye.
Thank you very much, everyone. With all in favor, the motion passes. And I look forward to opening up schools next week. Thank you, everybody, for all your work on this tonight. Thank you. At this time, now we can get back to our new job description. I don't know if I'm supposed to say item G3 because it was G1 already, but we'll go to the third item in section G now.
Thank you, Madam President, members of the board. This is a proposal to create a job description of school counselor, but we want to be very cautious in making sure that people understand the purpose of this role. This is actually in our school social work area, But by broadening the job description to include a counselor of social work that, or excuse me, a counselor degree and a master's in counseling with clinical background, it allows us to broaden the pool of applicants that we can interview to provide the kinds of social and emotional supports that we need. This is different from a counselor that is a school counselor that would do registration or attendance or scheduling. This is really somebody who has the clinical license to be able to provide social and emotional supports to students in crisis. So we are hoping that this will enrich the pool of applicants that come to our schools to provide services to our students. And so we're asking for your support of this new job description.
Thank you very much, Dr. Gonzalez. Do we have any questions or comments for Dr. Gonzalez?
Hi, this is Dr. Diaz. What led to, first, I just want to thank you for this. This is something that I've been advocating for quite some time, especially since we no longer have our SROs. I'm just wondering how you all determined that you wanted this position. What led to this?
Dr. Diaz, I would say that we are always looking for ways to make sure that our students have the best quality staff around them. And we've been very fortunate to have extremely high quality social workers in the field, and haven't had to necessarily broaden the applicant pool in the past. But as we know that our students' social emotional needs are increasing, and we know that some of our social workers are able to go into private practice, we know that we need to be competitive. And so this is something that our lead social work coordinator, Dawn Baumgardner, came to us with and said, what if we did this? And so the credit really goes to her.
Wonderful. Thank you so much. That's really great to hear. And I think it's powerful to get the voices of our staff on the ground and see the challenges every single day.
This is Dr. Bink. How many social work or counselor positions do we currently have open?
Open as in unfilled?
Yes, sorry.
One.
Okay, thank you.
Hearing no other discussion, do we have a motion to approve our counselor job description this evening?
Jessica Bueno, so moved.
Reggie Carrillo, I second.
Thank you all very much. May we please have a roll call vote, Ms. Miriam?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
and Laura Diaz.
Aye.
Thank you. With that, with all in favor, the motion passes and we have that revision made and we have that new job description. So congratulations. Thank you, Ms. Dawn. With that, we will mosey on to item I1 and for a request to approve travel dates for out-of-state travel for our CUBE conference. Do we have anyone besides the board to talk about this? Dr. Hoggat?
Yes, today we come to you with the interest of having the board approve the conference CUBE that some of our board members are interested in attending. And so we really want to make sure that we have the dates first so that we can then schedule the travel with all the needed arrangements. And so in the agenda, you will see that you have the schedule at a glance of the conference and the dates. And so today we would appreciate if we approve those dates so that we are able to start really the specifics for the travel itself.
Wonderful. Do we have any questions or comments on this item from the rest of the board?
Yes, I think the dates that are suggested are when the actual conference would happen. So I think I'm just gonna motion and request to approve that the dates include the travel. So us leaving on Wednesday, September 28th, and then returning Sunday, October 2nd is what I would like to put as the motion.
I agree. That is what we were talking about, I believe, trying to organize this item via email. But I did wait until now to bring that up since we could all talk about it at once. So I'm glad you brought that up. So I also agree. I do think that we should have those dates in there so that way everybody's able to schedule their come home that evening or that morning, depending on their needs, their individual needs. So any other questions, comments?
Do we have discussion now, or do we second the motion and then discuss?
We could definitely have a motion and then discuss after a second. So do we have a motion to approve out-of-state travel dates for September the 28th through October the 2nd?
Jessica Bueno, so moved.
Alicia Bink, I'll second.
Thank you. Any discussion?
My question was just, if we do those dates, is it just in between those dates would still work, or do we all have to fly in and out on those specific dates?
That's exactly why I think it's important to have the day before and the day after, depending on our needs, because I know you've got travel with, your little one and things like that. So no, we don't. We can, as long as we are traveling within those dates, not outside of them, to my knowledge, that we're good.
Okay, thank you.
Mr. Thomas, do you have any, clarification on that? If you're in earshot of our board meeting?
On the issue of, I'm sorry?
Travel dates. If we approve our travel dates as September the 28th through October the 2nd, would it be all right if, let's say, I needed to travel on October 1st?
Yeah, I think that there's some flexibility there if if you couldn't get flights or something like that.
Perfect. I just wanted to clarify. So my understanding matched yours. So thank you. I appreciate it.
And Mr. Thomas, also, we wanted to make sure that we clarified that our board is okay to travel a day later because the conference is over at 2 p.m., allowing them the opportunity to either come right after the conference if their schedule allows, or have the next day. We just want to make sure that we stay within what's expected.
Right. So you are, you're limited to the state guidelines for travel, which if I believe that if you, whatever your event is ends in the afternoon, you can come back the next day. It's authorized for reimbursement, and that's really what you're going by.
Thank you. We appreciate the clarification.
And our understanding came from this very issue, and then having to do our own research that other districts had more structured plans for that and what their decisions were based on. So I'm glad we're clarifying, and we are talking with, or I have spoken to Mr. Norris on this to try and get a better structure of understanding on how that works. So it's not so discretion based. We actually have some structure to it, and that way it can go be part of our onboarding for future board members and administrators. Thank you. With that, may we please, if there's no further discussion?
Yeah, I just want to chime in with what CUBE is.
Thank you.
CUBE is hosted by the National School Board Association, NSBA, of which we are happily still a part of to continue our own professional development as board members. CUBE stands, and I just pulled it up here. So the public's aware, the Council of Urban Boards of Education supports excellence in urban school board leadership and focuses on issues and challenges in urban core areas, of which Phoenix Elementary is wholeheartedly a part of. The downtown core is a part of our district. And so this is something that is relevant to the community that we serve, the students that we serve, and just the district, our district boundaries, the makeup of our district boundaries. And so if you want to find out more, you can go to nsba.org too and look up the CUBE conference for more about this opportunity that we're going to attend.
Thank you, Mr. Carrillo. I do think maybe in the future having, another small PDF about what the event is and having the schedule would be great. Just for future items, so that way the community there's that transparency of where we would like to go and what's going to be discussed. So with that said, are there any other questions or comments? Hearing none, may we please have a roll call vote, Ms. Miriam?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
and Laura Diaz.
Aye.
Thank you very much. With all in favor, our motion passes. And we can move on to item I2 to discuss approving a new board meeting time. So
Thank you again. Yes, this interest surfaced at our last meeting, and the interest is to have our board meetings begin at 5:15 instead of 6:15.
thank you. I do. I'm glad Mr. Carrillo made the recommendation last meeting and it's on this current agenda. So I guess to follow protocol, we will ask for a motion, second it, and then discuss. So do we have a motion to approve our new board meeting times?
Jessica Bueno, so moved.
Reggie Carrillo, I second.
Thank you. Any discussion? I'm looking at the attachment on here.
I am looking forward to the change. It was wonderful to get out when the sun was still out last board meeting, and I was shocked. And so like for this instance, we'd be getting out around 6:45. So yeah, I'm
Agreed.
looking forward to it.
But I'm glad our new calendar is updated with the new dates for Tuesdays. So I'm super excited. It is something that the board has been trying to work on to get board meetings a lot more structured so we could get out here at a more timely time and make better use of our time during the week to have a lot of our questions answered prior to the board meeting. So I'm grateful, and I'm also looking forward to the new 5:15 timeframe, especially the new date as well on Tuesdays. So if there's no further discussion or any sharing regarding the time change, we can move to a vote. Ms. Miriam?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
and Laura Diaz.
Aye.
Thank you very much. With all in favor, our motion passes. And our next board meeting would be August the 9th, beginning at 5:15 p.m. So I'm really excited about that. New changes coming with new leadership. So I'm really pleased with the tone being set. So congratulations, staff. We're going to be getting out of here a little early. All right, with that, we will move to item I3, any board requests?
I have two. This is Dr. Bink. The first one is that sometime in the future, maybe we plan ahead now to bring Dr. Morin back. I know there's some scheduling that needs to be done there with more information on what mitigation might look like based on the current data and research she's aware of. And then my second request is just for if someone could resend a copy of our current contract with Healthy Verify, I would appreciate that. Thank you.
Thank you, Dr. Veek. I'm making a note here.
Is this appropriate time to ask for board agenda item, or is that up next?
I think we should move on.
I have a request.
Oh, that'll be next, Dr. Diaz.
Thank you.
And then this is a request just based on the budget. I know that we have an excellent team that's probably already on top of this and is already looking at what other schools are doing. But again, just to impress upon the point, so our staff knows that we're understanding what other districts are doing in regards to the new budget that has passed and giving our staff a second look at how we can utilize that budget to positively impact their financial stability. And so I would like us to take a second look. I know our team has done great work and we've had a lot of discussions and raising salaries. But again, with the passage of a new budget is taking a second look at that, continuing to look at that and seeing how we can uplift them economically, our staff all across the board, bottom up from cabinet level to our certified and non-certified staff. So that's my request.
I also do have a request. I noticed that some of our job descriptions have changed to reflect that we prefer a bachelor's degree. But when you actually try to apply to the position and create your account, the first question that you have to answer is that you do have a bachelor's degree. So if we can kind of fix that bug as we're using a system to accept applications, I would just like to take care of that barrier.
Sorry about that. Okay, with that said, I believe we've all gone and now we can move to item I4 for future agenda items. Dr. Diaz, are you able to share yours?
Yes, thank you so much. So I know that this is coming soon, but I don't know if we already have it on the docket for future agenda item. But I really want to revisit our discussion around preschool offerings and get a status update at a board on where we're at with that. I know that there were a lot of different factors we were considering. Additionally, I wanted to also include in that conversation a discussion around equity and how we are going to ensure that our Montessori program is shared with our neighborhood families. In the past, the response that I've received is that it is by word of mouth. And I've said this, every time that continues to perpetuate the issue that our neighborhood kids are not in this preschool program because those who are enrolled are more affluent families. So not that their kids don't deserve a chance to attend our preschool programs, but we need to ensure that there is a marketing campaign directly targeted at our neighborhood families. So that's one item I'd like to have on the upcoming agenda. And then I would also, and Ms. Trujillo, President Trujillo, you've mentioned this before, but I'd also like us to discuss the transition from 8th grade to 9th grade and what we're doing as a system to ensure that all of our students are seamlessly transitioning to high school, and how that infrastructure is sustainable, and that no student is lost in the process. And that's all that I have. Thank you.
Thank you very much. That brings such a smile to my face. So yes, got it. Dr. Diaz, thank you very much. Any other agenda items?
I have one. It's just, and hopefully sometime in the first trimester, maybe, a receive and discuss of our discipline data. And because I know that we are collecting it now, and I would like to make sure that that data includes any time a student has been restrained for any reason, and any time a student is sent home before the end of the school day for some sort of disciplinary reason.
Got it. Thank you, Dr. Vink, for both of those. All right. Any other future agenda items? Okay. Hearing none. It looks like we can move on to adjournment already. Yeah, item J1. Do we have a motion to adjourn our meeting this evening?
Jessica Bueno, so moved.
Roger Carrillo, I second.
Thank you. Any discussion? Hearing none, may we please have a roll call vote, Ms. Miriam?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Hi.
With that, our motion passes, and we will see everybody in August. Have a great start to the new school year. We'll be keeping you all in our thoughts and good energies, and definitely be over to visit. So good night. Thanks for participating.